but a thalassemia carrier. She should be careful if she gets married to a partner who is also a thalassemia trait, because her pregnancy would then have a 25% chance of producing a thalassemia major child.
And this is how we represent this, to say that this is the male partner who's got one gene which is responsible for hemoglobin production, which is defective, but he's got a normal gene, therefore he's perfectly healthy. And this is the female partner who is also a carrier. So what happens is some of the sperms that he produces will carry the normal gene, some will carry the defective gene. Similarly with the woman, when she ovulates, sometimes she will ovulate with a good copy, sometimes she will ovulate with the one with the mistake. So there are only 4 combinations that can happen when this couple have children, and one of this combination will result in thalassemia major, where the child is unable to produce any hemoglobin at all. In population screening, in India with a population of 1 billion, we expect that there would be about 33 million carriers. It is impossible for us to actually go and screen everybody.
When we go to colleges, the first, impression on the student, no, not me.
It happens with certain families, and it's a torture for the family and for the children. I'm just talking seriously. You see, one day you may get this problem, then you will remember me. It's not a joke, and we have not come here to just talk rubbish.
In Greece, they have a very high incidence of this problem, but their conscription is compulsory. Therefore, all the men at some age or the other have to go into the army and spend a couple of years. So that's a very convenient point where you can screen all the men. In Cyprus, on the other hand, the priests will not marry you unless the couple show their blood reports. The advantage of methods like that is that there are already X number of children in the country who are taking treatment, and every year we are adding another 10,000 more children to that lot. And we have fixed amount of infrastructure, like blood transfusion facility and things like that. So what is happening, that the facilities are getting more and more diluted, less and less opportunities are being available. Whereas if we can put an end to this, some way control, constant addition, the existing children are also going to get better treatment.
Screening for thalassemia trait may be done at 2 points. Before a couple is married, to check for thalassemia status, as well as antenatal testing when the woman is pregnant, to prevent the birth of a thalassemia major child.
The best would be to screen them at the time when they come early in pregnancy and register with their doctor. So do a full complete blood test, just don't do a simple hemoglobin test, and you can pick up.
मैंने भी मेरा खून थैलेसेमिया माइनर के लिए टेस्ट करवाया, और अभी हमने हेतल का खून भी थैलेसेमिया माइनर के लिए टेस्ट करवाया, and we are expecting a clear results from that.
There are certain tests which we can do as early as the 10th week of pregnancy. There are some tests which we do later at 14, 15 weeks, and some done at 20 weeks of pregnancy. One of the best tests that we can offer for them is at 10 weeks of pregnancy, because it's got the advantage that nobody in the family needs to know that the woman is still pregnant. She could come quietly, gives her the opportunity for secrecy, and because we do it so early at 10 weeks of pregnancy, termination of pregnancy is safe and easy for her. The chance of an error with these tests is about 0.4%. Otherwise, the test, the way it is run, gives you a yes or no answer. There is no grey zone in that.
Although we do encourage people to go in for a prenatal diagnosis, in India we are probably, this is our karma, this is what we deserve. Those feelings take precedence over everything else. And I'm aware of a couple here who's enrolled in our transfusion program, whose child is enrolled, where in spite of medical advice and that there would be a 25% chance of a recurrence, he preferred to go on a Tirth sort of a thing where he visited temples in North India asking for blessings from God. He's ended up with 4 pregnancies and 4 children with thalassemia disease.
जाना था, हमने टेस्ट कराने जाना था हम बिना उस टाइम टेस्ट, फिर हमारे घर में कोई ऐसी प्रॉब्लम आ गई हम जा नहीं सके। मंदिर गए थे ना, उधर पुजारी ने हमारे को आशीर्वाद दिया कि बच्चे आपके ठीक होंगे। बच्चे ठीक नहीं, किस्मत खराब और क्या है।
I try and tell them that if one believes in God, a creator, or give it whatever name, that even these institutions and our knowledge or knowledge of doctors has not dropped out of the sky. These are also God-given gifts.
The time like now also, people are so much into traditional type, they go for the horoscope checkup. Instead of going for horoscope checking for both would-be husband and wife, they should go for the blood test.
Usually, thalassemia signifies a life sentence, but there is one cure.
Treatment of thalassemia is a long drawn out, lifelong and expensive procedure. However, there is hope in the sense that bone marrow transplant is currently the curative treatment for this disease. More than 200 patients have undergone this procedure in India at various centers. And depending on the grade of severity of the disease, we have different levels of success. So if the patient has been well chelated and the transplant is done at the right time, then there is a more than 90% chance of cure for such patients. For us to implement a bone marrow transplant in a thalassemic situation, the patient should have a brother or sister who is either normal or has thalassemia minor. There is a 25% chance of the donor matching with the patient. Therefore, with a smaller family, the chance of getting a donor is less. We are trying to expand the application of bone marrow transplant in thalassemia by having a cord blood bank. So the blood that is there in the umbilical cord and the placenta, which is normally thrown away, is actually put in liquid nitrogen. And then this blood can subsequently be used at any later date to potentially cure a patient with thalassemia major. Today the cost of bone marrow transplant in India is between 6 and 10 lakh rupees. Since the cost of bone marrow transplant is quite high, the majority of our patients are not able to afford it. Internationally, cord blood transplant is a relatively new procedure. So not many patients of thalassemia have undergone cord blood transplant all over the world. Having said that, we have the facilities to do that, and patients in India have successfully undergone umbilical cord blood transplantation.
Apart from the problem of finding suitable donors, the cost of bone marrow transplant is still out of reach of many Indian families, though that is the best bet for a complete cure. Instead of relying on traditional methods of screening like palm reading or matching horoscopes before marriage, do a simple blood test. Prevent thalassemia. There are safe, inexpensive methods of screening which exist widely in our country today, which can help any couple to prevent the birth of a thalassemia major child. If at all there is a birth of a thalassemia major child in the family, there is still hope that the child can lead as normal a life as possible, provided she receives proper timely treatment. Patients can lead productive lives if they follow the right precautions during blood transfusions and careful monitoring during chelation therapy. One can explore the options of administering a suitable combination of drugs, both oral and injectable, for iron chelation, thus doing away with a great deal of unnecessary pain and hardship. For the vast numbers of thalassemia patients, mostly children who are already suffering the pain of daily injections, we must think anew, using the ways and means at our disposal for the right combination of medication and care that will make all the difference. Then, the ties of blood that parents share with their children need not ever become a curse.